We were at this point of diabetes mellitus. See, assuming we have eaten lots of sweets, not considering the disease proper, assuming you have eaten lot of sweets, okay, you have gone to the restaurant and you have enjoyed the buffet spread of sweets. So the blood is having more of sugar. When the blood is having more of sugar, what the pancreas will do is, pancreas has to stimulate the secretion of insulin. Okay, pancreas has to stimulate the secretion of insulin. Once the insulin is released, it will be converting this glucose and storing it in the form of glycogen. The liver and this insulin together will convert this into glycogen and store it. And also the tissues or the muscles, they will use up this sugar. And reduce the
कल हाँ 19
they will reduce the sugar. See, it is simple. You have eaten lots of sweets. So the blood sugar level will be increased. Now this increased blood sugar level has to reduce to maintain the homeostasis. So what we'll do to reduce the blood sugar level? Pancreas will secrete insulin. This insulin will help to reduce the blood sugar levels, and also some amount of this blood will go to the liver, and this liver converts this glucose into the form of glycogen and it stores. Glucose is converted into glycogen and store, and also some amount of the sugar is used up by the muscle cells or the tissue cells, and hence by these three mechanisms the blood sugar level is supposed to reduce. Now we come across the disease called as diabetes mellitus. What happens in that disease condition? Pancreas or the insulin is not able to be secreted. And hence the blood sugar level, the increased blood sugar level is not reduced. Hence the increased blood sugar level is not reduced, and the blood sugar levels remain high. The blood sugar level remains high. Okay. Is this understood?
Yes, yes.
Okay. Yeah, thank you, Reji. Anybody else who has understood?
Yes, doc, I've understood.
Yeah, okay, next. Okay, so this is about the negative feedback mechanism. So let us see what is this negative feedback mechanism. It is a mechanism in which the effect of the response to the stimulus is to shut off the original stimulus. Okay, it is to shut off the original stimulus. So here the stimulus was increased blood sugar level. Here the stimulus was the increased blood sugar level. So what it did to shut off, that means we have to reduce the increased blood sugar level so that the homeostasis is maintained within the body. Now, next, moving on to positive feedback mechanism. Now here as you can see in the image, there is suckling of the breast by the baby. Whenever there is suckling of the breast by the baby, that is the stimulus. Okay. Now what is the receptor doing? Now this suckling of the baby, it will stimulate the receptors present in the breast. They will send a signal to the hypothalamus. This hypothalamus will send a signal to the pituitary gland to say release oxytocin. The suckling of the breast by the baby will send a response to the hypothalamus. Hypothalamus will further trigger the hypothalamus will further trigger the pituitary gland, and pituitary gland will secrete an hormone called as oxytocin, and this oxytocin will once the oxytocin is released, it will help in ejecting the breast milk out. And once the breast milk is ejected, the baby will suckle. Further again the baby suckles, then the hypothalamus is triggered, it will trigger the pituitary pituitary will release oxytocin will eject the breast milk out. So this is the continuous cycle. So this is the positive feedback mechanism. Yes. So next, this another one. Okay. See, whenever natural delivery has to happen, what happens is, so what you can see here is the baby's head is down and the feet is up. Baby's head is down and the feet is up. Okay, so this is the exit part. This is the exit part for the baby where the parturition happens. So the baby pushes against the cervix. The baby pushes against the cervix. Cervix is the narrow opening. Cervix is the narrow opening. The head of the baby pushes towards the cervix. Once this pushing happens, there is stretching. There is stretching occurs in the cervix. This stretching of the cervix will send a stimulation to the brain. Will send a stimulation to the brain. This brain will further stimulate the oxytocin secretes, oxytocin discharge or oxytocin release from the pituitary. This oxytocin, what it will do? It will help in contracting the uterus. It will help in contracting the uterus, and further the baby is expelled out. Further the baby is expelled out. So this is with respect to the normal delivery, or the it is with respect to the parturition. How the signals are being transmitted. Now after understanding this, see, this positive feedback mechanism intensifies the change in the body's physiological condition rather than reversing it. A deviation from the normal range results in more change, and the system moves farther away from the normal range. See, we should understand that during the course of a normal labor, there is lot of pain experienced by the lady. Okay, the pain threshold is very high. Okay, positive feedback in the body is normal only when there is a definite endpoint. So this, see, when we are applying this, the definite endpoint here in case of a childbirth is the delivery of the baby out of the womb. So there is a definite endpoint there. Childbirth and the body's response to blood loss are two examples of positive feedback mechanism that are normal but are activated only when needed. So these are normal, but we are doing it only on need. So as we talked about the clotting procedure, the clotting procedure. So the end point for the clotting procedure is the bleeding had to stop. The bleeding had to stop. So there is an end point over there. Okay. Yes. So any questions still here?
What's interesting, doctor, is that the bones of the baby is very, very soft. So therefore, it also helps to facilitate the movement through the cervix.
True. Because sometimes we are doing the instrument assisted delivery, instrument assisted vaginal delivery. At that time, as you said, the bones are soft because of the bones being because we are trying to expel the baby out through instruments. We also see that there are some marks of the instrument left over on the head, on the scalp, because the bones are very soft. Okay. Now another. Okay, so moving on to the last concept, that is the integrating systems. So we have studied that there are different systems in the body. We have studied that there are different systems in the body, like the cardiovascular, urinary, lymphatic, respiratory, etc. So these these systems, they work in coordination with each other. They work in coordination with each other to maintain homeostasis. Now, when we talk about the control of water balance or the maintaining of water balance within the body, it is the cardiovascular, urinary, and the lymphatic systems. All of them, they work hand in hand to they work hand in hand so that the water balance is maintained in the body. Now, again, another example: cardiovascular and lymphatic systems transport fluids throughout the body and help sense both solute and water levels and regulate pressure. So cardiovascular and lymphatic. So integrating systems is wherein the different systems of the body are working together. Different systems in the body are working together to maintain the homeostasis within the body. Okay. So I end the session here. Any questions can be asked.
Doctor, Has there ever been a calculation of if they're going to replicate the whole human being, how much would it cost?
No, I don't think we have thought in those lines. Say, just think, just a transplant of kidney will cost you in lakhs. So like that, there is no, till now we are not successful in transplanting the brain and all. So I think replicating the human would be really a tough task for the humans. Or I think we need to, our science or our knowledge, technology is not developed to such an high extent wherein we are in a position to replicate the human.
Yeah, but it'll be interesting if one could calculate it, and if human beings understand it, then they will damage their bodies through drugs and alcoholism and through
Yes.
poor eating habits and all those kind of things.
Yes, that's true, that's true.
Ma'am, one question is there, how painkiller works in our body?
See how painkillers work is, see, we have something called as centrally acting and peripherally acting. So I will just give you an example. See, whenever the females complain of dysmenorrhea, so they are the smooth muscles which are involved, or there is contraction of smooth muscles in the body. So what we are doing, there is contraction of those. So when we are giving meftal as a tablet, the smooth muscles are relaxed. See, the muscles are under some twisting action, and you give a muscle relaxant, the muscles will relax. Once the muscle is relaxed, the pain is subsided. They usually act as relaxants.
Okay.
Is this can be imitated through like things like yoga and breathing exercises?
Imitating, see, as a like if you have a generalized body pain, we call it as myalgia. We have a generalized body pain, then in those conditions you can do it with relaxation techniques. Like your deep relaxation technique, or also your QRT, quick relaxation technique also. See, you might have come across, okay, are you aware? See, I am a student of Yasvasa. Okay, so there when we studied, we come across QRT and DRT. QRT is quick relaxation technique and DRT is deep relaxation technique. Whenever we have done around 12 rounds or 24 rounds of Surya Namaskara, our muscles are fatigued and we are tired. Okay, but those muscles are immediately released, or we find a little relief when we do a QRT or a DRT. So I think that kind of fatigue, okay, in the generalized pain, we are able to release it with DRT and QRT. But when you are having a pain like shooting pain with respect to renal calculi, sharp pain with respect to the appendicitis, I think those pains we cannot control it with yoga, as like I have not yet tried in my patients. Okay, but the generalized fatigue or the fatigue after a marathon, walkathon, those can be relaxed through the deep relaxation techniques, etc. But the other things, like or what I said, the sharp pains, those we cannot relax it through the yoga, or I have not explored in that area.
I think some of it's possible through the breathing techniques. I experienced it while was going through acupressure on my body, and the physician mentioned that that actually I wasn't screaming as much as the other patients.
Okay.
Ma'am, I have one question. Yeah, my question is that right now I am 45 years of age, and still I am doing yoga and everything, and having a practice of running. Athletes drill we also follow. Just today also we run 10 kilometer, means weekly 10 kilometer, and in the meanwhile 1.5 kilometer to 2 kilometer daily running is there. So just as per considering our age, how much running is important or harmful for us? Means how it affects our joint. That I want to know, because I have seen our trainer, he is 60 plus, 62 years age, still he runs. So lot of questions are there, ma'am.
Okay, see, everything, whatever you do, especially say with respect to running, etc., or with respect to the physical activity, I cannot say it with respect to the age, but it is with respect to how you can resist it. See, I am assuming I am 30 and I'm running and I am not able to run for 2 kilometers, don't force yourself. But if you are comfortable in running 2 kilometers daily, even when you turn 60, then you can maintain it. But after the next year only, if you feel you cannot run for half a kilometer, don't try. It is how much your body is going to support you. It is how much your body is going to support you. If you are getting exhausted, if you are panting at the end of 2 kilometers, then reduce it even before that. But if you are comfortable, able to run up to 5 kilometers, then you can go ahead. Then you can go ahead.
Okay,
we
ma'am.
cannot fix
Right.
we cannot
Correct.
fix because say it depends on individual stamina. You're a trainer, he's practicing it on a daily basis and it is a part of his lifestyle. He may be doing it for years and ages, so his body's stamina is increased or stamina is better than yours, and hence he's able to run up to 6 kilometers with this age. I think even with the even if he's 70, he will be able to at least run up to 4 kilometers. That is how he has trained his body. That is how he has trained his body.
Yes, ma'am. My question was slightly different, that joints are affected considering the age or not? Means daily running, suppose you said about synovial fluid. So running affects the synovial fluids or any joint mechanism, it affects
Yeah.
our age? That I
Yeah,
was asking.
yeah, joints are affected. Joints are affected. There is wear and tear. There is wear and tear. But I cannot tell, see, for your sir at the age of 60, it didn't happen. For you also, it won't happen. I cannot say. There are few chances
Okay.
it may happen or may not happen. And if you are slightly obese, you are slightly on a fatter side, there is a chance that you are being affected much more faster. And
Yeah,
also,
yeah.
if you're eating foods which are not nourishing, like if you're eating the dry foods or the junk foods, then there is a chance you are being affected faster. See, one thing is
No,
the physical
now,
activity. See, one thing is the physical activity that will affect. The other thing is the food what you take, that will have a role. The other thing, if you are fatter, that will have a role.
fatter means, ma'am?
Obese, your
Oh,
weight is
okay, okay, fatter. Yes, yes, yes. Understood.
so all this contributory, it will affect the knee joint.
Okay, ma'am. Tendon, you told that yeah, muscle to bone connection is called tendon,
Mm,
and ligament bone to bone connection. Correct?
mm.
So
Yeah, perfect.
muscle to muscle connection.
See, there is nothing like muscle to muscle connection, because once a muscle begins, it begins in a bone only. Once a muscle has to start it, see, we have something called as an origin and insertion. So this origin and insertion, it begins in a bone and ends in a bone only.
And muscle to cartilage connection. Mean
Muscle to
cartilage.
so muscle to cartilage, there is no such connection. So when muscle is connecting to cartilage, it may end up in a tendon.
Tendon. Okay, okay. Thank you, ma'am.
So, doctor, does muscle grow out of a bone?
It is not out. It is not growing out of the bone. It is like how our skin is draped by clothes. We are draping our skin by clothes. Similarly, the bone is draped by muscle.
Yes. Okay. Okay. So it's a separate thing in the
Yeah,
growth.
yeah, yeah.
Separate. Doctor, people with drugs addiction and alcoholism, although they may fix themselves up and without relapsing or anything of that nature, but they start the lifestyle and they go wild, they still tend to have enormous problems in their bodies itself, like for instance, and can end up in death. And yet they can look very well. Is there such serious damage taking place in the bodies that the bodies will regret at a later stage, a few years after they stopped any of those things?
No. See, whenever somebody is under the influence of drugs, it is the drugs which act. It is the drugs which act. But if they have withdrawn from it properly, if they see any drug like a drug or alcohol or smoking, they all should be withdrawn gradually. They all should be withdrawn gradually. Once they have come out of it gradually under proper medical supervision, then I don't think they will suffer from anything. They will not suffer from the disease. But this gradual withdrawal, when they are doing the gradual withdrawal, again, see the withdrawal, you should understand at what level are they doing withdrawal. If the alcohol consumption is withdrawing from alcohol after the liver cirrhosis has taken place, then he will not suffer from the withdrawal symptoms, but he will suffer from the complaints of liver cirrhosis. So you should understand after taking the drug, after the drug abuse, after what injury to which part of the body they have withdrawn from the drug. After understanding that, we will be able to say what is the damage happening.
So it should be done in a structured manner. In that case, it cannot be done cold turkey method, like stop.
No, it can't. No, you cannot arrest it immediately. You cannot stop it immediately. You will suffer from withdrawal symptoms. Even when you are withdrawing, you should also understand what all organs are being damaged, or are they damaged or not. If they are not damaged and it is withdrawn in a tapering way, then the person will come out of it easily. But if there is a damage and then he is withdrawing, the damage has to be addressed.
Okay. Because sometimes the best thing is to do in that kind of situations I've seen with people smoking, and they try to reduce the smoking. They go back to the original amount of smoke they have smoked previously. So and lots of times they are advised to just stop immediately, and that's cold turkey method.
But see, when especially with respect to withdrawing of smoking, they undergo with nicotine patches, etc. So that's a gradual way of tapering smoking.
But those systems haven't really worked where they try to taper it. It hasn't worked. Many people we've come across, and it's only the cold turkey method. They force themselves to stop completely, even with alcoholism or even with drugs as well.
No, but see, whenever they are arresting whatever they are doing, if they arrest it immediately, there are chances of withdrawal symptoms being seen. Okay,
yes.
So that is how they are gradually tapered. As I said, see, cigarette smoking is replaced with nicotine patches. So cigarette, whenever they smoke, there is nicotine which is released. So that particular action only is done with the nicotine patch. Then gradually that nicotine patch also will be withdrawn along with the medication.
Yes, they do have nicotine patches to do.
Yeah.
Yes.
Okay, any questions, or shall we wind off?
Ma'am, my last question is that in any back pain or back injury, forward bending is completely restricted. So is it correct that which side bulging or which side herniation of disc has been happened, we don't know. But in all cases, it is clearly mentioned or we instruct our that in back pain or any back injury, forward bending is restricted. So is it correct, or some alteration may be there?
See, yeah, as you said, we have to see where is the nucleus pulposus and annulus. Okay, so your question is very practically correct. So you should see, one thing is, whenever we are doing a forward bending or even a backward bending, okay, whenever we are doing this bending procedures, the what we studied about the intervertebral disc, I'll just try to put the image. That intervertebral disc will undergo a compression. See, just assume it like you have a burger. You have a burger wherein you have cutlet in between. You press the burger front. Okay. You press the burger front, the cutlet in between is squeezed. You press the cutlet backwards, the cutlet in between is squeezed. So similarly here, intervertebral disc is like the cutlet. Your any forward and backward movements will have an impression or will have a compression over the intervertebral disc. Again, compression of this intervertebral disc will further compress the nerves. Compression of the nerves will again increase the pain.
Yes.
So I practice for my patients will avoid forward and backward bending both. See, why doctors always advise forward bending is, many times we are doing forward bending with our day-to-day activities. We bend forward to pick up some things, to pick up bucket, water, etc.
Yes. Now, if you want to lift anything, then we have to knee down, means we have to bend our knees, and then we can lift. Then, ma'am, Surya Namaskar is completely prohibited during back pain.
See, what happens is when you are carrying a bucket of water, there is certain amount of stress generated through the shoulder joint and applied to the spine. Your spine is playing a role when you're carrying a bucket of water. So there is
Yes.
some amount of stress that is being exerted on the spine.
Okay. Okay. Thank you, ma'am.
Yeah. Okay.
Ma'am,
So
last question, ma'am, last question. During
yes.
our running, I have measured through my course watch that my heart rate goes 180, 183 like that. 183. Today also I have measured 183 like that. So is it good or some bad indication? I can't understand. In long
See, no. When is your heart rate 183?
during the sprint or stride when I am just running.
Okay.
At that time it
Now,
goes.
assuming you're at rest, what is your heart rate?
Normally my heart rate is 60, 65 like that. Very low.
See, okay. See, whenever somebody is doing an action, whenever they are doing an action, or say whenever you are doing an action of sprinting or striding for the marathons, etc., obviously everyone's heart rate is increased. Once you are at rest, if your heart rate is coming to normalcy, then you are totally normal. It's not only yours, everyone's heart rate is increased at that time.
Is there any parameter that how much times it can go up during a stride or a sprint like that?
There may be a parameter which I am not aware. I think people with sports medicine will be aware of it.
Okay. Thank you.
Okay. Yes.
Okay,
Any
thank you.
question? Yeah.
Lot of thanks, ma'am. You just cleared all my all our questions and deliberately given a very brief knowledge. Subject is very vast, but one day class is not enough to understand these things. Okay, you covered lot of subject, lot of topics, but we should study. Then we can understand it more details in depth.
Yeah, you're
Overall,
right.
very good, very good.
Yeah, thank you.
Doctor,
Yeah,
would you putting would we receive what the entire course will be going through, the various subject matters?
see, one thing is like what we studied in like how we came across in Ayurveda session. You will be
Yes.
coming across the slides will be shared to you. PPT will be shared by Sadaranji or Sati, and also the list of systems that we are going to study. I think the syllabus is already there. That will be sent across. I will tell Sadaranji to share it.
Thank you. Thank you. And the number of sessions has been determined yet, or still to be determined as we progress?
I think we'll do it as we progress because now today, see, we are attending the session since 2 hours 46 minutes. Okay, might be for Zoom we have wasted 10 minutes, but other than that, we have studied for mostly 2.5 hours. If all the participants here are okay to understand, so today we actually had clubbing of muscular system and skeletal system. So from the next session, I'm just planning to take one system. So next will be just the digestive system. Okay, but still I think all our sessions will be 2 hours, at least minimum 1 hour 45 minutes will be our session. Okay, I just hope that see, next is the digestive system. Just go through few words of digestive system and just come so that you are able to understand the words. You don't feel they are French and Latin. Already they are. Okay, just be familiar. Yeah, 1 second. So one thing is sessions will be long because it is like what our students learn in a period of 1 year. I'm teaching you in few sessions. So just think. Okay. Next thing is kindly go back and go through all the slides, whether you understand or not. Just get familiar with the words. Okay, so that whatever you study here may be interlinked with some session in the next session. When I say that word, at least you should understand if it is a bone or a muscle or what it is. You should be able to grasp that.
Very good advice. Thank you. Thank you very much for on the session itself. because where we come from in South Africa, accents do make a difference with my also hearing capacity as well. So thank you very much. Appreciate it.
Thank you, ma'am. Very nice session. Nice knowledge.
Just a second. Somebody is saying something. There's a girl who is answering. Yeah, please.
Ma'am, is it possible it will be start from 4 p.m. to 6?
See, the timing is fixed from 3 to 5 p.m. and we are extending till 6. If we start at 4, we'll end it by 7. Okay.
No, 4 to 6, it will be 2 hours, no? So 4 to 6 it is possible.
No, what I'm telling is already the sessions are extending. Since it is
Okay.
anatomy and the terminologies and everything is new for the participants, I need to keep on repeating. So the sessions will extend. That's what I mean to say. Or rather, I would say the timing is fixed to 3 to 5. Okay. Yeah. Any other questions? Okay. So shall we conclude the session?
Yes, ma'am.
Sure, sure.
Yeah. Thank you.
Yes.
Yeah.
Thank you so much. Thank you.
Yeah, I
Thank you so much,
wholeheartedly
ma'am.
thank all the participants for patient hearing and being with me till the end of the session. It's really good. I'm happy that you people are enthusiastic in learning. But this enthusiasm should be shown in going home and reading this again so that you understand, you're able to get familiar and then start afresh for the next session. Thank you. We'll be meeting day after.
Doctor, thank you for making it interesting. That's why we stayed on.
Okay, yeah.
Ma'am,
Thank you, Doc.
ma'am, we can get these notes.
Yeah, surely. Sadananji will be sharing it to you.
Okay, ma'am.
Okay.
Nice
Thank
session,
you,
ma'am.
one and all. Yeah,
Bye.
thank you, one and all.
Thank you, ma'am.